Since even before COVID vaccines got approval for use, many experts had warned that vaccine hesitancy would be among the biggest battles in reaching herd immunity. But in recent weeks, hesitancy has been declining, particularly among Black Americans. In fact, a new poll shows it's white Americans who are less likely to get a COVID shot these days, with one group in particular holding out the most: Republican men. Nearly 50% of whom now say they will not get the vaccine when it becomes available to them, up 4 points from last fall. That also happens to be the same group leading the charge in rolling back restrictions in states like Texas and Florida, the latter of which saw large spring break crowds over the weekend with little to no distancing or mask wearing in sight, prompting this warning from the director of the CDC.
I'm pleading with you for the sake of our nation's health. Cases climbed last spring. They climbed again in the summer. They will climb now if we stop taking precautions when we continue to get more and more people vaccinated.
I'm joined by Dr. Vanessa Kerry. She's director of the Global Public Policy and Social Change Program at Harvard Medical School. She's a physician at Mass General Hospital and the CEO of the nonprofit Seed Global Health. Dr. Kerry, it's good to see you as always.
Thank you. It's great to be on again.
You know, the GOP men's number is just, I don't know why I'm laughing, is staggering. Is this just trickle-down Trump? We know he hid the fact that he got the vaccine. He was always dismissive of all of the COVID protocols, mask distancing, etc. Is it trickle-down Trump?
I think it's hard to know what is driving this. It's certainly trickle-down politics and a continuing, I think, divide in our country about how we are going to run ourselves, who we're going to be, and, you know, what the role of government is in a pandemic or in any of our lives. And so it doesn't surprise me to see this trend, but it does sadden me. I mean, the reality is that the only way this country is going to get itself and the world is going to get itself back to some semblance of normal is if we get some vaccination rate, about 75 to 85% of the American and global population gets vaccinated. Having such a large group of people or cohort be unwilling to get vaccinated is going to be very disruptive. And I do think this is politics at play. When you have the new administration in place, which is Democratic, they've come out in force, sort of trying to set new mandates and public health protections and being able to really talk about what it takes. And I think this is a bit of blowback against that. And it is going to hurt all of us if it doesn't stop.
You know, there are a couple of high-profile guys who weighed in on this issue this weekend. First, here is Dr. Fauci on Meet the Press being asked if it would be helpful if Donald Trump weighed in. Here's Dr. Fauci.
I hope he does. How such a large proportion of a certain group of people would not want to get vaccinated merely because of political consideration. It makes absolutely no sense.
Now, that was yesterday. Today, the President of the United States was asked a similar question and had a little bit different take.
The thing that has more impact than anything Trump would say to the MAGA folks is what the local doctor, what the local preachers, what the local people in the community say.
What's your take as a general matter? Is it the big boys and girls who we want to hear from, or the people in our community who we know and trust? Who's the most powerful influencer?
I think, honestly, it's both. Because at the end of the day, people listen to different people, and we need advocates on all fronts. I think if President Trump, he actually did once come out, I think it was roughly about a month ago, and said everybody should go get the shot. He said it sort of in a more quiet
CPAC,
forum.
Yeah.
And
he said it just in passing, yeah.
In passing, exactly, it's CPAC. But if he comes out more publicly, I think that would have a big influence on many of his followers and supporters. Certainly when local communities rally, their leaders are going to be obligated to listen to them. Those are their voters. And we've seen that throughout history. I mean, part of my work is that I run Seed Global Health. We work on the African continent. In West Africa during the Ebola outbreak, one of the biggest things that allowed people to change culture to stop the disruption of, to disrupt the Ebola transmission, because people were washing dead bodies, as was the custom in their countries and religions. It was the imams that came forward and said, we get this as part of our religion, but our lives, your future depends on our being willing to let go of this, culture or this tradition and God will forgive you and be a part of it, and blesses you and being willing to have you go forward with it. So we know local leadership matters too, and can play an important role. So if folks want to be safe, if folks want to have a normal 4th of July, if folks want their children in school, we're going to all have to get vaccinated unless you really have a reason, not to. The hard part for me as a healthcare practitioner, an ICU doctor who's been on the front lines of this, who's exhausted and seen my colleagues be more exhausted than me, it was very difficult for me to read the articles about the Texas nurses and doctors who watched their governor take away the mask mandate. They are exhausted from this year of work. They have been on the front lines of saving people's lives, and they know exactly what's going to happen, which is another surge. We are not out of the woods yet. It's hopeful. The numbers are plummeting, but the reality is we are in a plateau right now, which is very concerning that we're going to start to see that tick upwards again. And if that does happen, we could be in trouble. I think people don't understand that the longer this virus is allowed to transmit unchecked without people being vaccinated, the more likely we are to get these variants that can be deadlier, more contagious, and could thwart the vaccines and disrupt all the progress that we've made over the last year.
Dr. Kerry, I want to go back to what you just said at the beginning about herd immunity, whatever the appropriate number is. Some people say 70, 75, 80%, whatever that number is. Let's assume there's this huge block of Republican men that don't move, and they're joined by the traditional anti-vaxxers and whoever else, people who can't get access. If we don't reach herd immunity, I think we've all operated under the assumption the issue is when, not if. But if we don't reach herd immunity, what happens?
If we don't reach herd immunity, then COVID is still going to be able to transmit at a rate that people will continue to get infected, will continue to present to the hospital, and will die. The reality is the vaccines right now at this time all seem to prevent hospitalization, severe illness, and death. And that's a big deal because that's what's been overwhelming our healthcare system. That's what's been keeping people getting screened for cancer. That's what's been disrupting prenatal care. That's what's been disrupting cardiovascular care. And that's what's been having people lose family members that they love. If we don't get to herd immunity, not only will that continue and COVID will be allowed to transmit in a way that is going to continue to stress the hospital systems of the United States and other countries, but we will not be able to get our economy back on track. Schools will not be able to be open reliably because children will continue to be at risk of getting COVID. And very importantly, variants will be able to develop. And what variants are basically is that COVID is able, just by chance, by sheer luck, it mutates. And if it mutates in a way that allows it to evade the vaccine or to be more contagious or to be deadly or to do something, it can escape. And it can, it ends up reproducing more, spreads more. And if one of those mutations evades the vaccine, which we've seen with the South African variant and the AstraZeneca vaccine, an entire country had to shut down its vaccine program because the vaccines it was slated to get don't work against the variant. That could happen here in the United States against our vaccines. And if that does that, whether you're vaccinated or not, it doesn't matter. We are in COVID pandemic again. We're doing this all over again. We're masked again. We're not seeing our loved ones. We're mourning people. That is a very real reality if we don't get ourselves to herd immunity now. We are racing a clock, and I think people don't realize that.
Because I don't do what you do, I can engage in something I'm sure you condemn, which is vaccine shaming, and I know you won't do it. People like you don't believe in it. But are there times when you're sitting in your house rather than leading an organization or in the ICU where you say to yourself, let's look at the facts here for a second. We still have 10,000 people dying a week in the United States from the virus. Yet, as far as we know, of the tens of millions who have gotten the vaccine, not one single person has died. Yet there still is this controversy. I mean, what is wrong with us?
Well, I think that's a very complex answer. The reality is that, again, I'm going to go back to the politics. I don't just say that in my house. I say that all the time. Nobody has died of the vaccine. There have been reactions, yes, but no one has really died of it. Tens of thousands, millions have died of COVID. And that is a reality. And so when you look at the comparison, the vaccines really are very well tolerated, and they are a road to our life again in the way that we know it. They're a road to safety. Their health security is economic security, is national security, is our individual security. And vaccines are central to that at this time. And it's not just vaccines for the US, it's vaccines for the whole globe. Because again, if a variant erupts in another country and comes to the United States that evades the vaccines, we are in trouble. So I'm very public about that reality. But what's wrong with us, I think, truly is that science and medicine and this pandemic has been politicized. It has become a political tool that has been used now to sort of be a stand of whether you're for or you're against. And really what we're talking about is something that is about the human race, should be for or against. All of our lives are on the line in this. All of our families are on the line in this. Our economy is on the line in this. The way we want to live. We all want to be free again and to be able to see our families and to celebrate and to do things. If we don't do this together, we're all going to suffer together. And I think that it's that politicalization, if that's a word, of this pandemic is going to be one of the greatest tragedies, I think, of our time.
I, for one, am for living. Vanessa Kerry, thanks so much. It's great to see you as always. Appreciate it.
Thanks for having me.